A very good morning to one and all. Today I am going to present free paper on the topic Steep Axis Clear Corneal Incision guided by phone app decreases post-operative corneal astigmatism. The reform of cataract surgery from vision restoration to refractive surgery is widely accepted, and because refractive surgery offers more precise surgical design and faster restoration of functional vision. There have been many methods of correcting astigmatism, which include arcuate keratotomy, limbal relaxation incisions, clear corneal incisions, and toric IOL implantations. But clear corneal incision is less complex and requires less computation than toric IOLs. We also know that postural changes such as transition from an upright position to a supine position may produce a mean cyclotorsional effect of 0.4 to 4.2 degrees. And this effect may be cyclotorsional or excyclotorsional. In this study, however, the keratometry is usually recorded with the patient upright, whereas the eye surgery is performed with the patient supine. We have tried to minimize this effect using the app, that is iToric Patwardhan app, which has an inbuilt gyroscope which works with conjunction of the camera. The methods, material and methods. The aim of the study was to assess residual astigmatism in patients undergoing phacoemulsification with steep axis incision determined by Android mobile-based app. The objective was to assess change in corneal astigmatism at 1 month after surgery. The study was conducted in a tertiary care center in northern India. The duration was 1 year and the study type was prospective observational study. The sample size calculated by Charan Biswas formula was 81 patients, and the patients were recruited according to the inclusion criteria, which included astigmatism up to 1.5 diopters, clear cornea, age between 18 to 70 years, and cataract suitable for phacoemulsification. Patients with corneal disorders and previous ocular surgery in the same eye were excluded. Written informed consent from the patients was taken, and proper history and visual acuity was recorded. Best corrected visual acuity slit examination was done. The keratometry was done on IOL master. A pre-operative corneal marking of the 0 to 180 degree of the steep axis was done on iToric Patwardhan app, while patient was sitting in an upright position. The app gives corrected steep axis and a landmark is identified near to it. The corrected steep axis was then marked pre-operatively while the patient is lying on table using toric marker, and a clear corneal incision was given on the same. The surgical procedure was the patient was operated under topical anesthesia. The surgery was phacoemulsification. Axis was identified on table. Post-operative evaluation, both unaided and best corrected visual acuity was checked on logmar charts, and keratometry was done on IOL master at 1 month post-operatively. A total of 32 males and 36 females were there. The age distribution, this pie chart shows the age distribution. The pre-operative versus post-operative best corrected visual acuity was significant. The steep axis pre-operative versus post-operative was significant, and there was a reduction in post-operative astigmatism. We went ahead and applied vector analysis to our post-operative findings. These charts were given by the Astigmative software. The first table shows the target-induced astigmatism, which shows the range of astigmatism that the surgery intended to induce. The second graph shows the surgically induced astigmatism, which is the achieved range of astigmatism. And the third shows the difference vector, which shows the remaining astigmatism and provides a summary of the astigmatic error considering both magnitude and axis. The difference factor is an absolute measure of success. Our study had a difference vector of 0.6, and the correction index shows the under correction versus over correction of astigmatism treatment. It can also be used as a measure of success. An optical optimal outcome is equal to 1, while in our study the optimal outcome was 1.1. Discussion. Dooley et al. Conducted a similar study with the control group, and both arithmetic values and vector analysis were statistically insignificant in their study. Jinshyati and Marek et al. Also conducted a study in which they showed that temporal clear corneal incision was found to be better than super clear corneal incision. Conclusion. There was a decrease in the arithmetic corneal astigmatism in patients undergoing phacoemulsification with steep axis incision, which was corrected for ocular cyclotorsion using mobile phone based Android app, that is correction for ocular cyclotorsion. The app is highly useful and adds to the value of surgery without causing any economical burden to the surgeon or patient. Thank you.
Yeah, that was a nice presentation. What was different, because this app has also been checked out earlier. So what was the difference between your study and the earlier studies?
Ma'am, we can use this app to reduce the burden. As we all know, Virion is very costly for the surgeon as well as for the patient. And if used, obviously the surgeon will charge for it. This app comes free of cost and also adds value to the surgery in decreasing astigmatism. And it's very useful.
So that
Very
is already
easy
known,
to
right?
use.
Yes, yes. So any specific finding you got? Anything that was new?
In previous studies, there was a difference between right eye and left eye. We didn't find any difference in right eye versus left eye, and there was no correlation with the axial length also.
Okay, thank you. That was a nice presentation.
Shilpi, when you go to study, would you went on to study whether the app is working fine or it suits for the surgery, or what was the aim of the study?
So the
Message.
usefulness of the app and whether it works or whether this.
See, if it is giving the right axis 90 as 90, that is one aspect of that. You were trying to prove that it is showing the right axis, or you were trying to say that it can be used?
So it can be used.
That's known, no? No, when you people go to study, what is the question at hand for which you are...
So that...
Compare it with the Virion and you found that this was more accurate or less accurate. That was
More accurate.
That would have been...
probably something compared to, comparison between two things, technologies, and then you compare and say one is better or the other.
Ma'am, none of...
Just a thought, maybe for way forward.
Yeah, good, thank you.